All right, good morning, everyone. Thank you so much for joining the Using PSYCKES for Assertive Community Treatment Act Teams webinar. This is hosted by the Office of Population Health and Evaluation. My name is Michelle Rahm. I'm from the Medical Informatics team, and I'll be leading today's training. So just some housekeeping before we get started. We have muted all of the phone lines to help prevent any background noise, but we encourage you to still ask your questions today by using the Q&A option in WebEx. And you can access that option by selecting the three dots on the bottom right-hand corner of the screen, and then you can select the Slido polling and Q&A option there. And that's when you can type in your questions, and then you just click the send message icon, and it will be reviewed by our panelists on the call. And then we'll also be doing Q&A at the end of the webinar where we'll read some of your questions out loud and answer them in real time. And then we will be sending the slides and recording link to everyone after the webinar is over. And we'll also be posting them to our public PSYCKES website shortly. All right, so here's our agenda. We have a lot to go over today. We're going to start with a PSYCKES overview, which will talk about what PSYCKES is, what data is available in the application, who's included in PSYCKES, what types of reports we have, and then we'll transfer over to accessing PSYCKES. So some of you might already have access to PSYCKES, some of you might not be sure if you have access, some of your agencies might not even have access quite yet. So we'll go over the process for how to get access to the application. And then we'll start talking about levels of access to client data in PSYCKES. So we have a few different levels of access options that we'll be reviewing today. And then we'll talk about how to enable access to that client level clinical summary. We'll go over some population health filter options within recipient search that are relevant to ACT teams and your treatment model. We'll also be talking about client level details that exist within the clinical summary. And a lot of these details can be helpful for the CANS assessment that a lot of you are filling out. So I'll be sure to point some of those out as we go through the clinical summary in detail. Then we also have a PSYCKES mobile application. I feel like a lot of people don't know about this, but you can take PSYCKES on the go with your iOS or Android device and look up clients and view their clinical summary data if you have consent or the appropriate level of access in the field. You can also create safety plans or screenings and assessments for that person as well, right in our mobile application. We also have MyCHOIS, which is the recipient-facing version of PSYCKES. So I'll do a brief overview of what MyCHOIS is in case it's of interest to you and the clients that you're working with. And then we have a polling section. So every webinar, we really love to get our users' feedback on what would be helpful for us to add into the application. That would really help support the work that you're doing. So we have a polling section where there'll just be 3 questions, but we'd love to get some of your feedback on what we can enhance PSYCKES with to help support, especially the ACT treatment team model. And then we'll end with training and technical assistance in that Q&A portion. All right, so we'll start with our PSYCKES overview. So what is PSYCKES? PSYCKES is a psychiatric clinical knowledge and enhancement system. And what it really is a secure HIPAA-compliant web-based application that takes data from multiple different data sources and puts it into one user-friendly format to help support population health, quality improvement, care coordination, and clinical decision-making. And we have multiple ongoing updates in our application. We have our quality indicator reports. Those are updated on a monthly basis. And then that client level clinical summary, that's updated on a weekly basis. Now, who is viewable in the application? So right now we have over 13 million individuals that are viewable in PSYCKES, and this includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatments, or folks that have had some time at a state psychiatric center or state PC inpatient or outpatient service, or individuals who are in health home outreach or enrollment according to the DOH MAP system. And then within PSYCKES, we have data across the treatment spectrum. So it's not just limited to behavioral health data. We also have general medical information, crisis services, medications, dental and vision, residential services, even lab and pathology. And then we've added this note down here to let folks know that we do have what's called non-Medicaid clinical summaries, and these are available for clients who have either been served by a state PC or by a provider agency utilizing MyCHOIS within the PSYCKES application. So the information that's included in the non-Medicaid clinical summary would be data from state health administrative databases like state PC EMRs, data coming from NIMERS or CARES or TACT, or even safety plans entered in by providers. And now, as a future enhancement, I just want to let you all know of, we are looking to create a non-Medicaid clinical summary for every instance that someone exists in other state databases or systems outside of state PC EMRs. So if somebody has experienced homelessness and that's recorded in the Department of Homeless Services database, then we would create automatically a non-Medicaid clinical summary for them. So uh, homeless services, if they've had SOS or CTI, etc. Any type of data that's stored in a state database for them, we would automatically create that non-Medicaid clinical summary view. So that's a future enhancement we're currently working on. All right, now we have the data available in PSYCKES. So we have that client level clinical summary, and it provides up to 5 years worth of data. Again, that's updated weekly. We really have two main buckets of data sources in our application. So we have our main bucket, which is Medicaid fee-for-service claims and managed care encounter data. And again, this is across treatments settings, not just limited to behavioral health data. So we have information on medications coming from Medicaid, medical and behavioral health outpatient and inpatient services, ER and crisis services, care coordination information, and more. With Medicaid data, there is a data lag. So from the time the service occurred to the time it shows in PSYCKES, the lag really depends on what type of service it was and how quickly that bill is turned around. So something like an ER or outpatient service could take upwards of a few months to show in the application from the time the service has occurred. But other things like medications, we've seen those to be pretty quick with a turnaround time of 14 days or maybe even less from the time somebody picked up that medication to when it shows in PSYCKES. So that's just something to keep in mind with the Medicaid data. There is a data lag. But that's why we have our other state administrative databases, and these are considered more real time with a 0 to 7 day lag for the time that the service or the service occurs to the time it shows in PSYCKES. So we have a list here. I won't go over all of these, but just to name a few, we have Department of Homeless Services coming from DHS. So you can see if somebody's been in outreach with DHS for homeless services or if they've stayed at a shelter. You can see the admission and discharge date, the shelter director contact information, the shelter name, etc. We also have information coming to us from DOH MAP. So if somebody is enrolled in a health home, you can see the name of the health home, the admission date, if they were discharged, the discharge date, and also the referral contact information as well. And then the care management agency downstream provider. And then we have state PC EMR data. So if somebody spent some time at a state PC and that state PC doesn't bill Medicaid for that service, we still get access to that data because we have state PC EMRs as one of our data sources. And then AOT, Assisted Outpatient Treatment Provider and Service information is coming to us from OMH TACT. And then ACT, Assertive Community Treatment information, that's coming to us from both Medicaid billing and CARES. So CARES also provides us with housing and residential information. More recently, we've added home-based crisis intervention program data as well from CARES. So that data source continues to grow. And then we have suicide attempt information. This is coming from OMH NIMERS. So this is an instance in PSYCKES where it's not limited to any type of look back period, such as 5 years. This is all available data. So if somebody had a suicide attempt occur 10 years ago, that would still show in their clinical summary because it's such critical information. And then safety plans, screenings, and assessments. These can be entered in by you as a provider in PSYCKES, and I'll show how you can do that through our PSYCKES mobile app and through the clinical summary in the web. And then we have intensive mobile treatment. Mobile crisis team data was recently added from DOH-MH. So a lot of different data filing into the PSYCKES application. And we include a slide always to show folks that we have what's called quality indicators, otherwise known as quality flags. So PSYCKES really uses these quality indicators to identify clients who have any type of quality concern in order to help inform you as the provider to support that clinical review and decision making and to help support quality improvement projects. So we have our statewide reports and MyCHOIS reports. These are updated monthly, and this is where you can see quality indicator prevalence rates at the statewide, the region and county, the provider and program, and the managed care plan levels. Now, right now we have over, I think, 80 quality flags in our application. So these are just very limited examples shown here. But we have, for example, no diabetes monitoring for individuals who have diabetes and schizophrenia, folks who have low medication adherence for individuals with schizophrenia. We also have high utilization indicators. So this will look at folks who have had 2 or more or 4 or more inpatient or ER rooms or emergency room services. And then lastly, just our last example here is eligibility for Health Home Plus, but that person hasn't had a Health Home Plus service in the past 3 months or the past 12 months. Now we have this last bullet here to just inform you that we have what's called the performance tracking indicators in PSYCKES, and these are unique because they're run by the Department of Health on mature Medicaid data. So we have our PSYCKES run measures, and then the Department of Health run measures, which have an intended 6 or more month data lag to allow for complete service invoicing. So you'll notice in the application, and I'll point this out, that the as of date for the performance tracking measures is different from our PSYCKES run measures because it has that intended billing lag. And then this slide's just going over what types of reports we have in the application. So we have our client level clinical summary, which is an individual level report, and that takes that Medicaid billing and all of those state databases and compiles that into one view for that client's treatment history. And again, that's up to 5 years worth of data. Then we have our provider level reports, and this looks at MyCHOIS report, and that's where you can see your current performance, your agency's current performance on all quality indicators. So that would compare your agency's prevalence rate to the region and statewide prevalence rate. And in PSYCKES, you'd want to see the lower the prevalence rate, the better. And this is where you can drill into a specific quality indicator and review the names of clients who meet criteria for that specific quality flag. You can also enable access here in the QI report as well. Then recipient search, we'll spend a lot of time on this screen today. This is where you can run ad hoc reports to identify any cohorts of interest that you're working with and want to focus on. And we also have advanced views. So on the recipient search results page, we have a standard view. And then our advanced views are where you can select a specific advanced view of interest and add on columns to your results page. And I'll just show our advanced view options as well in the application. And then here you can enable access as well in recipient search. Then we have usage reports, and those are used to monitor protected health information access by staff. So you can log in and see, run one of these reports and see who's logged into PSYCKES recently, who's enabled access via consent or emergency access recently. And then we have our utilization reports, and these were really built to support provider value-based payment data needs. And then lastly, we have our statewide reports. So this is where you can go in, select a quality indicator, and review the statewide proportions by different levels, like provider location, region and county, client residence, region and county, plan or network. All right, so now we're going to talk about access to PSYCKES. So how to get access when your agency does not have access, what you'll need to do is complete and return 2 pieces of documentation to our PSYCKES help desk. So that includes the PSYCKES Access Online Contact Form, which is in SurveyMonkey. And then we also have the PSYCKES Confidentiality Agreement, which is a fillable PDF that your CEO or executive director would need to sign. So those two pieces of documentation are needed for us to begin the PSYCKES access request process for your organization. We have these resources on our About PSYCKES webpage. So if you go to psyches.org and then go to About PSYCKES, that's where you can find both the SurveyMonkey link and our confidentiality agreement. You can always reach out to our help desk to get those two pieces of documentation as well. So after we receive the confidentiality agreement and the completed SurveyMonkey, then the CEO or ED would need to electronically sign the confidentiality non-disclosure agreement for access to what's called the Authorization Management System, or AMS. So this is where the CEO or ED would log in and then sign the CNDA and then designate security managers. So they can either elect themselves as a security manager or elect other staff members to have that security manager role. And the security manager is responsible for enrolling PSYCKES users at your agency and then also revoking access when staff no longer require access to the PSYCKES application. And then when your agency does have access, that's when you as a staff member would need to contact your agency's designated security manager. And just to note, agencies, we recommend you have more than one security manager so that folks have somebody they can get in touch with rather than just one person who might be out on vacation or out for an extended period of time. There's multiple people who can manage access to OMH applications at your agency. So you can always contact our help desk to find out your agency's security manager. We also will be providing an access table to everyone in our email after the webinar. That'll include our slides, the webinar recording link, and then this access table, which has all of your ACT team agency names. It'll show you whether your agency has PSYCKES access, and then it'll show you all of the applicable active security managers at your agency. So you'll be able to see who you can contact at your agency who can grant you access to PSYCKES. And then once you're granted access in AMS, you'll receive an email on how to log into what's called the self-service console. And this is where you'll need to go to request and activate your token. And your token is what's needed to log into PSYCKES. So that'll all be included in that instructional email. And then once you do get access, this is just how you log in. You go to our PSYCKES homepage, psyches.org. We always recommend you bookmark this page rather than the next screen, which is the login screen. We recommend you book psyches.org, bookmark that page just so there's no cache or browser issues, which we've found sometimes when people bookmark the next screen. So this is where you click log into PSYCKES. And you, as a provider agency, would select external local provider. And this is where you'd enter in your assigned OMH issued user ID and then your passcode. So if you have a hard token, which requires justification to get a hard token, you'd enter in your PIN followed by the 6 digits on your hard token into the passcode section. And then if you have a mobile token, this is where you type in your PIN into the mobile token and then copy and paste that passcode over into the passcode section. So that's how you log into PSYCKES. And now we're going to switch over to levels of access to client data. So now we'll really start talking about the application and so showing some screenshots of PSYCKES. So client linkage to agency, clients can be linked either automatically or manually to your organization. So automatically would mean that the client had a billed service at your organization within the past 9 months, or they're enrolled in your agency's health, home, or care management program according to the DOH MAP system. So that's how individuals are automatically linked to your agency, but you can also link people manually. So that means you as the provider log into PSYCKES, locate that client and attest to either the client signing the PSYCKES consent. We also have the DOH Health Home consent and a BHCC consent form. We have verbal consent attestation, clinical emergency, and then you can also attest that the client is currently being served by or transferred to your agency. So this slide describes what those different levels of access entail in PSYCKES. So with assigned consent, this is your best option to view all available data for 3 years after the last billed service. So this means when you drill into that person's clinical summary, you can even view data with special protections, and that includes substance use disorder, HIV information, family planning, and genetic testing. And this is for 3 years after the last billed service. So that means if your agency continues to bill for that person or receive services for that person, then that timeline continues to renew. So that really is the best option to get signed consent. But we also have verbal consent, which came about during the pandemic. So this allows you to obtain consent verbally for a client and access their clinical summary. However, you will not be able to access that data with special protections. And this access is only for 9 months after verbal consent is attested to in the application. And then we have clinical emergency. So this allows you to access all available data, including data with special protections, but just for 72 hours. And the next slide will go over what constitutes a clinical emergency. And then the last option, attestation of service, meaning the client is currently being served by or transferred to your agency. This only links clients to your recipient search reports and will not provide you access to the clinical summary. All right, so this is just a slide on the criteria and protocols for clinical emergencies. So if a client refuses or cannot consent and is having a clinical emergency, then you as the provider are permitted to go into PSYCKES and access their clinical summary without consent, otherwise referred to as breaking the glass. So the definition for a clinical emergency is a medical or behavioral health condition for which there is an immediate need for treatments and symptoms are of sufficient severity that the absence of immediate treatment would likely result in serious harm to self or others. So here's just some examples of criteria for breaking the glass. This is not limited to these 4 instances, but these are just some examples that were thought of. So threats or attempts at suicide or serious bodily harm, homicidal or other violent behavior, inability or refusal due to their mental illness to provide for their own essential needs, and then overdose, sedation, altered mental status, catatonia, or otherwise they're non-responsive. So those are just some examples of criteria you can consider breaking the glass for. And then it's on the providers to really ensure that the medical records support emergency access by documenting why and how that client meets criteria for a clinical emergency and attesting to that with their signature, the date, and the time. And then we have a visual access level comparison chart. So this really just repeats what I just went over in the last couple of slides, but it's just a helpful graph to see how clients are linked and what level of access you get to their data based on the access type. So this could be something you print out or save. It'll also be, of course, included in these slides when we send them out. So I won't go over it again, but this is just a visual version of what I've just discussed. And now we'll be going over the consent form for PSYCKES. So we have the top half of page 1 of our consent form, and this just really details what PSYCKES is, what data is included, and then the option that that client has or that legal representative has to give or deny consent. And I do want to note we do have the PSYCKES consent form and withdrawal of consent form available on our website. And it's available in 10 languages currently, and we're adding more very soon. Now, the bottom of page 1, this is the portion where the person decides to either give or deny consent. So in this example, this person gave consent, and it looks like the legal representative, the father of this client since they're a youth, has signed on behalf of Jane Doe. So you can see the name of the patient's date of birth, their Medicaid ID number if they have one, and then the signature of the patient or their legal representative. So this was John Doe signing on August 1st. He printed his name and then described his relationship to the patient as well. So it's Jane Doe's father signing on behalf of her. Then this is the top half of page 2. So this talks about how providers can use that client's information, what information they'll be able to access with consent, where the data is coming from in the application, and the client's who can access that client's data with their consent from that agency. Then the bottom half of page 2, this really goes over what the client can do if they feel somebody is improperly accessing their information. So here in this example, they can either call John Smith at the agency, and it gives their phone number, or they can also call the OMH customer relations phone number there as well if they feel like somebody is not correctly accessing their information. Then below that, it'll talk about when the providers can share the client's data, the effective period of the PSYCKES consent, and then below that, in number 8, this is an important section on where the client can get the withdrawal of consent form from. So they can either get it by calling Jane Doe at this phone number. It can also be obtained on our website, psyches.org, and then who they can submit that withdrawal of consent form to. So that might be the same person, like in this example, or it might be 2 different people, because that person who receives the withdrawal of consent form should most likely be the person logging into PSYCKES and withdrawing that consent from the application. And then number 9 talks about just giving the client a copy of the signed consent form. Now here's the required procedures for obtaining and documenting consent. So the first one would be confirming the client's identity. So that can either be through you as the provider attesting that you know this is the correct client, or the client can provide one form of photo ID or 2 forms of non-photo ID. So with legal guardian representative status, you would have to confirm that. If it's not the biological parent, it would need to be a court-appointed individual. So you just need to verify that legal status if needed, if somebody's signing on behalf of somebody else. And then reviewing the consent form in its entirety with the client or legal representative. So it's very important that consent is informed. And then that person will either give or deny consent, and a copy must be provided to them and then saved in an appropriate location within your own agency's records, such as the client's chart or your EHR. And then we added a note here. So for anyone with certain disabilities, it's important that the ADA guidelines are followed. So if somebody, for example, has visual impairments, then the consent form must be read aloud to them, or a screen reader must be made available. All right, now we'll talk about how to enable access to client level data. So we've just went over the different access levels. Now we'll show how to do this in the application. So in this example, we're going to use Recipient Search, the individual search tab. As I mentioned earlier, there's also other ways to enable consent, like in MyCHOIS report. There's also our registrar menu, but just for today, we'll just use Recipient Search. So here's where you'd enter in the specific recipient identifier. So that could be somebody's Medicaid ID or social security number, which are usually recommended as they're unique and only typically return one result. But if you don't have that information, you can also search for the client's full last name and either date of birth or their first name as well. And you can even add on additional characteristics such as the age, gender, race, ethnicity, or their client region or county. Now here's what this looks like in the application. So we've gone to Recipient Search in the purple navigation bar, and then we've gone to the Individual Search tab, which is where you land. So in this example, we're looking for somebody using their Medicaid ID. Below that, this is where you have the name, date of birth, and characteristics options. So once you enter in your search criteria, you can click Individual Search. And here on the results page, since we used a unique identifier like the Medicaid ID, we have one recipient found that matches that search criteria. So we can see John Doe here. We can see their unique identifiers, their race and ethnicity according to Medicaid billing, their address, their managed care plan, any Medicaid quality flags they meet criteria for, the planning considerations column, which I'll go over in a little bit, and then the current PHI access. So in this example, I just want to make sure I'm looking at the right person I want to enable consent for. So I'll double check their name, their age, their date of birth, their Medicaid ID, their race and ethnicity, and their address, just to feel extra confident that this is the correct person I want to enable access for. And then in the right-hand column, you can click on Enable Access. So this is where our Enable Access module will pop up, and this is where you can select the level of access for that client. So at the top, we have the different consent options like PSYCKES consent, BHCC, or DOH. Below that, we have the other reasons such as verbal consent or clinical emergency. And then the last option is attesting to serving the client. So in this example, we're going to do the client signed a PSYCKES consent. But if you ever have questions or forget what one of these specific access levels entails, we have the About Access Levels hyperlink here, which you can click on, and it'll give you just a little bit more detail about each option. So when we click next, now we have to confirm that this is the correct client. How do I know that this is the correct person? So I can review the unique identifiers, date of birth, and address again. And then either I, as the provider, can attest to knowing this is John Doe. I know it as the provider, or John Doe can provide me with one photo ID or two forms of non-photo ID, and I can select those below. And then at the bottom, you'll just see a note about what level of access you'll receive. So with PSYCKES consent, we'll be given access at Main Street Agency to all available data for 3 years after the last billed service. And then when we enable that consent, and you can either go to the clinical summary. Here we went back to recipient search. We can see that John Doe, I can now drill into their name. And over here in the right-hand column, you can see that PSYCKES consent is enabled. So that's how to enable access in the application. Now we'll go into population health with recipient search. So we have on the recipient search screen, clients are linked to a provider agency if you've billed for them in the past year or if they're currently linked to your agency through DOH MAP. So in recipient search, we have a large number of different filters you can choose from. So this list is just a small example of options that you have in the recipient search screen specific to ACT teams and what might be helpful for you to utilize when running recipient search reports. So the first one, we have ACT enrolled or discharged in the past 12 months. We also have an alerts filter. So here you can look for folks who have experienced a suicide attempt, ideation, or self-inflicted harm or injury. We also have a complex needs filter. So here you can select if folks meet any of the complex needs criteria or a specific complex needs criteria. We also have social determinants of health or SDOH. So this is where you can select a specific SDOH domain or condition. We also have new Medicaid recertification filters in the application. And then you can look for folks who have a specific type of diagnosis linked to their clinical summary. And then lastly, I'll show services received from your agency or other agencies in New York State, such as ACT services, mobile crisis, HBCI, etc. And on the results page, when you do run a recipient search, you can export to Excel or PDF or enable access. And then we also have our advanced views listed out here. And I'll just show a screenshot of what these look like later on. So I'm going to go over each of these example filter options that we have just so you can see what it looks like in the application and really think through how recipient search might be helpful for you in completing maybe the CANs or for clinical review or clinical decision making or quality improvement even. So in recipient search, we're no longer on the individual search tab. We've toggled over to the cohort search tab. And I always like to point out if you run any type of search, the default will show you 50 names on the results page. So if you're running a search and you notice there's 100 people that meet criteria, you'll only see 50 names unless you come back to the search screen and adjust the limit number of results to and expand that to the number that would show you all recipients on the results page. So we'll start with our populations and planning considerations section. We have a few different buckets of filters that I want to go over here. The first one being our high need population filter dropdown. So this is where you can search for clients who have, for example, received SOS in the past year. They were either enrolled or discharged, or folks who were enrolled or discharged in CTI in the past year. And these were two of our newer filters that were recently added, so I wanted to highlight them here. You can also search for individuals who are high fidelity wraparound likely eligible. And high fidelity wraparound is a research-oriented, evidence-based care management approach that's been proven successful with children with serious emotional disturbance who have significant cross-system needs. So there is required criteria for this filter, such as the age range from 6 to 21, currently health home enrolled, and then currently have that K3 serious emotional disturbance status. Or two mental health diagnoses within the past year. So this might be helpful for youth ACT teams to see who qualifies for high fidelity wraparound. And then we have ACT enrolled or ACT discharged in the past 12 months. So these two filters utilize CARES, and they're updated on a weekly basis. So this is one way to search for folks who you've served at your agency in the past year who have either been enrolled in ACT or discharged in the past 12 months from ACT. And then we have our alerts drop down. So this includes at the top, you can select folks who have had any of the listed alerts below, or you can go ahead and select one specific alert to search with, such as suicide attempt in the past year from either Medicaid billing or the NYMERS state database, or folks who've had suicidal ideations or self-inflicted harm, injury, or poisoning. And then we also have opioid overdose filters as well. So this could be overall helpful to know just in general, since it's such critical information who has had an alert. But then specifically for ACT teams, when you're completing your CANS assessment, I know the risk behavior section might ask for information on suicidal attempts or ideations in the past. So this might be a helpful search to run when completing that CANS assessment as well. And then we have homelessness alerts. So this is one of our special filters where you can actually multi-select up to 4 homelessness alerts in your search, and it uses an OR logic. So in this example, we can search for folks who've had shelter in the past 1 year according to DHS, or outreach in the past year, or they've been sheltered in the past year according to Medicaid. So you have options to either search using all sources up at the top, so you can see who's had homelessness in the past year regardless of what source it comes from, or you can be more specific and just looking at who's had DHS homelessness or homelessness according to Medicaid billing. And then complex needs. So this was really a flag to help identify clients who require a higher level of service prior to hospital discharge, and really identifying eligibility for individuals who could use higher intensity services. So this is another multi-select filter that we have here at the top. You can search for folks who have met any of the complex needs criteria below, or select up to 4 specific complex needs criteria here. And we have it divided into 2 categories. So we have all ages for general eligibility criteria. And then below that, we have criteria that's specific to children and adolescents, which is 0 to 20 years. So here highlighted, we've selected folks who've had Youth ACT services in the past year, and then individuals who, for example, had partial hospitalization within the past year. So this again uses an OR logic. If you select more than one, it'll look for that criteria or the other one you selected. And I cut off a little bit of this screenshot for the general eligibility criteria just to show the other section that we have down here. So here's a slide that shows all available complex needs criteria in the application. I won't go over all of this, but it's here just for reference. And of course, when you log in to PSYCKES and go to the recipient search screen, when you drill into that complex needs dropdown, you'll see all of these available options to select from for your search. And then the last section or filter that I want to look at in the planning populations and planning consideration section is a newer filter that we've added, which is plans and documents. So here you can look for individuals who have had any plan or document added to their clinical summary in the past, or you can look for individuals who specifically had, for example, a safety plan or a psychiatric advance directive or PAD added to their clinical summary in the past. There's no look back period here. So this is folks who've ever had any type of plan or document added to their clinical summary. Now you can run the search. For example, I could see who at my agency that I've served in the past year has had a safety plan ever added to their clinical summary. And I can see the number and the names on the results page, but in order to drill in and view that safety plan, I would need consent or emergency access to view the actual safety plan or document. All right, and then I wanted to highlight here the social determinants of health SDOH section. So the SDOH conditions come to us from Medicaid billing Z codes currently. So we have, I think, around 13 SDOH domains, which are these larger categories here. And then the subcategories, you can actually open up a domain by clicking on this little minus sign, and the subcategories within that domain will appear. So you can hold the control key down and select more than one SDOH domain or condition for your search. You can select up to 4 per search. It will be the OR logic again. But here is also where you can find some SDOH conditions that might correspond to risk behaviors or adverse childhood experiences that teams work to identify in that CANS assessment. So this just might be a helpful search tool that you can use when completing the CANS assessment in CARES. And then we have Medicaid enrollment status. So we've gone down to the managed care plan and Medicaid section. And I wanted to highlight the Medicaid enrollment status filter because this is such a hot topic right now. And we do have future enhancements coming up for this section. So just to show what we have currently in the application, you can search for individuals based on their Medicaid status, whether it's active or inactive. You can even search who's had their Medicaid coverage expire recently within the past 3 months. We also have Medicaid recertification filters that were newly added. So we have the option to search for who needs to recertify within the next 3 months, and then more specifically with it renewing via NISO or the local Department of Social Services. And then more recently, we've added Medicaid recertification due in less than 1 month. So folks who need to recertify within the next month, you can generate a list of those clients that you're serving that need to recertify within the next month. And you can even narrow it down to who needs to recertify via NISO or LDSS. We are working right now on new Medicaid expansion population filters. So this would be a new filter on who is in the expansion population, and then a filter on who might be subjected to the new work requirement rule that's coming in 2027. So we're hoping to add these features by early December. So more to come on that. But this is what we have currently, and we are definitely working to add enhancements and new filters to this dropdown and create new filters for the expansion population in a separate dropdown. All right, and then we have our quality flag section within recipient search. So I want to draw your attention to the as of date here. So our quality flags are updated on a monthly basis, which is different from a lot of the filters in recipient search, which are typically weekly. Our quality indicators are updated monthly. So just a reminder to check the as of date when you're running a report. We also have the definitions hyperlink on the top right to see the definitions for all of our quality flags in the application. You can hold the control key down and select up to 4 quality flags per search. But here we've highlighted just some that might be of interest to you as ACT teams. So a couple are no follow-up after mental health inpatient or ED visit within 7 days of discharge. And then below that, we have no engagement after mental health inpatient stay. So this looks at people who have been discharged from the mental health inpatient unit who did not receive 5 or more follow-up visits with a community-based mental health care provider within 3 months after discharge. And then below that, we have no intensive care management after MHED or MH inpatient stay. So this is really looking at individuals who have been identified as having high mental health needs, such as ACT enrollment. And then we're looking to see who's had ACT enrollment services in any of the 3 months prior to an ED or CPEP admission, who did not receive high intensity care management services like ACT in the calendar month following their discharge. So I know that's a mouthful, but we have this included in our definitions link. And if you have any questions on these measures, you can always reach out to us. But these were some of the ones that could be relevant or useful to you as ACT teams. And then we have further down on the recipient search screen our medication and diagnosis section. So here you can look for folks who uh, by by prescriber using the prescriber's last name. It's a fuzzy search logic to see who I'm serving that has received services from or medications from a specific provider. You can also search for a specific drug name and even indicate if you want to look at individuals who are actively on that drug as of the report date. And then down here we have the psychotropic and non-psychotropic drug class. So you can select, for example, who is in general on the psychotropic drug class antidepressant. You can run a search for that. But more importantly, I wanted to highlight here the behavioral health and medical diagnoses section, since I know diagnoses are included in the CANS assessment symptom modules. To identify individuals who have, for example, have depression or anxiety or neurodevelopmental disorders. This is where you can search for individuals linked to your agency within the past year who have a specific diagnosis. So in this example, we've expanded the depressive disorders category, and you can select from any of the subcategories beneath, like major depressive disorder. If you want to search for just a category in general, you can just select depressive disorders and see who has been billed for any of these diagnoses or who has had any of these diagnoses included on their claims in the past year. And then at the bottom, you can actually also search for an individual diagnosis by typing that in here. And you can even type in the ICD-10 code, the number of times it was given in the past year, or if you want it to be in the primary only position. Your agency name would be pre-populated in the provider section. So I'm logged in as Main Street Agency. I can see current access. So I could see, for example, who has PSYCKES consent at my agency, or who has emergency access, or who just has attestation of service. Maybe I want to look at folks who only have attestation of service and focus on trying to get consent for them to view their clinical summary. But below that, we have our service setting box. So this is where you can expand the service setting categories, such as care coordination, and see the specific subcategories within that. So here we have in care coordination, we have Main Street Agency provides ACT services according to Medicaid billing. So we have these service settings to select from in the services by specific provider section. So here I could run a search and see who, for example, has received ACT youth services, specifically at Main Street Agency. And I'll run an example search for that shortly just to show you what the results page looks like. Now this looks very similar, but this is the services by any provider section. So here you can see the provider name is blank. You can type in any provider name in New York State. But what I wanted to point out here was the service setting box. That looks just like the one we just went over. But this is a little bit different in that you can look for folks who have received, for example, Youth Act services from any provider in New York State. It's not just limited to your provider agency you're logged in as. So if you ran a search for this, you'd see who am I serving at Main Street Agency that has received Youth Act from any provider in New York State. So we have a large number of different service settings you can choose from. So ACT is one of them. We have PROS, we have CORE, we have CFTSS, Mobile Crisis, SOS, etc. So a large number of service settings to choose from. And then the last filter option I wanted to point out in recipient search was in the same section, services by any provider, we have a way to look up quote unquote high utilizers at your organization. So this would be the service utilization and number of visits drop downs. These work in conjunction with each other. So in service utilization, you can see there's different service categories like clinic mental health, ER, or inpatient. So in this example, we've selected ER all, and then we've gone to the number of visits drop down, and we've selected who's received 10 or more ER visits for mental health, medical, SU, etc. in the past year. And maybe those are the people I want to focus on because they've been going to the ER pretty frequently within the past 12 months. So we've run an example search here as Main Street Agency. I wanted to see who am I serving at Main Street Agency that has received adult ACT services from my organization. And we can see 271 people received ACT adult services at Main Street Agency. So on the results page, I can see their name. This is just scrambled because it's identifying and we wanted to de-identify for this training, but you'd be able to see their name, gender and age, their Medicaid ID, their date of birth, race and ethnicity, their managed care plan, any quality flags they meet criteria for, their planning considerations column. This shows you things like notifications if, for example, they meet any complex needs criteria or they need to recertify their Medicaid. You can also see if they had any documents attached to their clinical summary. And this is one of our newer columns that we've added, which is special because you can view this data even without access to their clinical summary. So just as a future enhancement update for that Medicaid expansion population that's going to go live at the end of the year in early January, we're hoping to add some notifications here so you can see when you run a search who is part of your Medicaid expansion population and who might be subject to those work requirements just on any type of search you run in recipient search. Then we have another example search for a Main Street Agency who's received Youth Act services from my agency. So maybe these people, I can see none of them have PSYCKES access. There's only 11 recipients found, so maybe these are the folks I want to focus on getting access for and getting consent for in the application. So I could drill in, view their details, and help to complete that CANS assessment that I'll be working on. So we also have the option to toggle to an advanced view. So if you click on that eye icon, this is where you can view what additional columns could be added to your results page if you select one of our advanced views from the dropdown. So in care coordination, for example, I can see if somebody is enrolled in ACT, I can see the ACT provider name in one of those columns. And this is just for if you have consent for individuals, then you can see the data in these additional columns. All right, I'm going to speed up a little because we have a bit more to go through and I want to make sure there's enough time for questions and polling. So we're going to go over the clinical summary now, which is the client level details, and it summarizes up to 5 years worth of the client's treatment history. And the clinical summary really takes data from Medicaid billing and other state databases and provides an integrated view of that information. So things like hospitalizations, state PC data, health home enrollment, our outreach from MAP. We have suicide risk information coming from NIMERS. Just a wealth of information can be included in that clinical summary. And it really takes all this data and summarizes it into user-friendly, easy-to-read treatment episodes to really help support that rapid review for our users. And we have episodes of care, which are linked to detailed dates of service, and you can drill in and view information on diagnoses and procedures that were associated with that service. And then we've really organized the clinical summary into sections, very similar to how an EMR looks. I just want to highlight here, the clinical summary has just a wealth of information that I think would be applicable for the CANS and CARES assessment that the ACT teams are doing. So I'll make sure to highlight where I think there could be some overlap between the two as I go through the clinical summary slides. So these are the available sections in the clinical summary. I won't go over all of them, but it just shows you that there is not just behavioral health related information in here. Things like dental and vision, again, living support residential, and more are included in the clinical summary. All right, so we've drilled into a client's clinical summary. The information again scrambled, but you'd be able to see their name and their general information at the top. Right now we've landed on what's called the brief overview. So this really takes all of the data in the full summary view, which I'll show, and puts it into a quick snapshot for a very easy to read, rapid review for the most critical information for the user. So right now we're on the brief overview. You can see this person has in the current care coordination section, ACT services from Creedmoor. You can see they were admitted. They're still enrolled in ACT since there's no discharge date, and you can see the main contact information. So this is coming from CARES and is updated on a weekly basis. They're also part of a housing residential program. Other things in current care could include if they have DHS services for homelessness. So if they're in a shelter in the past year or discharged from a shelter in the past year, that data would be included here. Or if they have SOS services in the past year, AOT, all of that type, all of those types of information could be included in the current care section. And then we have notifications. So this is where you can see information on if they're meeting any of the complex needs criteria. You can see which specific criteria they're meeting. So this person was ACT enrolled or discharged in the past year, and that proves to be true because they're still enrolled in ACT with Creedmoor. You can see this, they've also experienced mobile crisis according to DOH-MH, and you can see information on the crisis team, the referral date and source, the presenting problems and diagnoses, and the case information in this current status of that case. And then more recently, we've added Medicaid eligibility alerts here so you can see this person's Medicaid expires at the end of this month. So this might be a client I want to work with getting recertified before August 31st so they can keep their coverage without any gaps. And I can see that I need to help them recertify through LDSS. So we have some links here and also a link for a facilitated enroller if the client needs help recertifying. Here's where you can easily see quickly if there's any alerts for this client, and it's all available data. So this isn't just the past year look back. It can be up to the past 10 years or more even for if a client had suicidal attempts or ideations, if they have a positive screening like the suicide screen or the depression screening. Also, if they've had an opioid overdose, something like that would show in the alert section. And then you can see if they've had any SDOH conditions in the past year reported in billing. And then scrolling down, you can see what quality flags they're meeting criteria for. You can also see diagnoses in the past year. So this is broken into behavioral health and medical. So you can see most recent diagnoses and then most frequent based on the number of services. So this is a quick way to see what their most recent and most frequent diagnoses are. And then we have medications in the past year, and then outpatient providers. And then lastly, all hospital and crisis utilization services. And this is actually looking back the past 5 years. So you can see separated into sections, ER visits, inpatient admissions, and any crisis services they've received in the past 5 years. All right, now we've toggled over to the full summary view because there are more details you can see in the full summary view, and I'll make sure to show that. So when we scroll down in the full summary screen, we have the alert section. So here's where you can see the specific alert type, the number of events, meds or positive screens, the first date and most recent date for that alert, the provider name that was linked to that alert, the program name, and then if applicable, the severity, diagnosis, medications, or results. So this is a way you can see in a table view their most recent alert. You can also toggle to a graph view to see any types of patterns in their alerts visually. And then scrolling down, we have social determinants of health. So this is where you can actually drill into a specific SDOH condition like sheltered homelessness and see the specific date of service where they were billed for that specific SDOH condition. So this person received this condition when they went to the ER for mental health at New York Presbyterian Hospital, and you can see any other diagnoses that were included on that claim. So again, the SDOH section, I know has a tie-in with the CANS assessment. Then quality flags, this is where you can see what current quality flags somebody is meeting criteria for. Again, these are updated on a monthly basis. What's helpful here too is you can actually toggle to a graph view to see how long someone has been meeting criteria for a specific quality flag. And just to note here, you can see some of these measures have different as of dates. These are because they are run by the Department of Health, so they have a bit more of a lag than our PSYCKES run measures. Plans and documents, screenings and assessments. So this is where you as the provider can go into the clinical summary and fill out either a safety plan template or a psychiatric advance directive template and add that to the clinical summary. Or you can upload any other types of documentation that's relevant to their care or treatment planning right in this plans and documents section. So I'll show what both of these options look like. But below that, we also have the screenings and assessment section. So we can see this person recently had a PHQ-9 depression screening. I can see the results for that screening, and then a suicide screening as well. Back at the end of July, I can see they're high risk. So this might be something that I work with this person on. Now, if you click upload a planner document, this is where you can select what type of planner document you're uploading with our drop down. So you could do safety plan, care plan. You also have the option to select other. You need to input the date the document was created and who it was created by, along with their role. And then you just need to choose that file from your computer and then upload it to their clinical summary. If you did the create new button on the clinical summary, we have the safety plan Stanley Brown template within the application, which you can fill out here. And then we also have the fillable NIAPRS Psychiatric Advance Directive as well. And then the diagnosis section, so we have behavioral health diagnoses and medical diagnoses. And you can drill into a specific diagnosis and see information on the date of service, the service type and subtype, the provider name, and then any other diagnoses that accompanied that claim. The integrated view of services over time. So this is considered or called our IVOS graph. And this is where you can see just a visual of treatment service, medication pickups. You can just see a visual of patterns for both services and medications. And you can actually hover over a line or a dot and see the provider name along with the date. So this person has been enrolled in ACT with Creedmoor since the beginning of May in 2025, and we can see they're still continuously enrolled in that program because of the line. And then care coordination historical. So this is where you can see if somebody hasn't received ACT in the past year, let's say they were discharged beyond a year ago, this is where you could go to see any historical ACT information. So we can see this person is currently in Creedmoor. And they also have recently received, or maybe not so recently, received CTI services. We can see the CTI team name. And then the procedure includes if it was a successful or attempted contact and where that contact occurred and for how long. Other types of data you can see here would be health home information or health home plus. If that person was ever on AOT, that type of data would show here. So it could be a great way to see any historical care coordination services someone has received in the past. And then we have our medication section. So in the clinical summary, you can see controlled substances, behavioral health, and medical medications. And here you can see the drug class and drug name, the estimated duration, and first day and last day picked up. And what I want to highlight is if you click on one of these little blue boxes on the corner, in the corner there, for a specific row, that's our See Details button, and a pop-up will appear, and you can actually see each specific pickup for a particular medication. Then we have outpatient behavioral health. So this is where you can see, for example, ACT services again. You can see according to Medicaid billing if someone has received ACT. We can also see if they've received clinic services, core or pros. We can see the service type and the provider name, the first and last billed dates, the number of visits, the most recent primary diagnosis, and any procedures that accompanied that service within the last 3 months. So if you drill in, you can see that same information. However, you can also see if practitioner information was included on that claim. And then outpatient medical, very similar, so I won't go into detail here just for time's sake, but it's very similar to the behavioral health outpatient services section I just went over. Then we have crisis services. So just to highlight here, we have recently added the mobile crisis DOH/MH service type. So here you can see the provider name, admission and discharge date, the length of stay, and most recent primary diagnosis, and then the most recent procedures. So what type of contact was that? Was it face-to-face or phone? Were they transported? Where did they end up? Etc. And then hospital ER services. So this is where you can see a history of somebody's ER inpatient services that they've received by service type, the provider name, the admission and discharge date, and the length of stay, the most recent primary diagnosis, and procedures associated with that ER or inpatient visit. So we have a prompt slide here just to really hear from you on when it would be most useful for you in your workflow to review the clinical summary. Um, it'd just be helpful to hear from all of you as attendees on when this data would be most helpful for the work that you do. So please feel free to write into Q&A and let us know your thoughts, especially as ACT teams, just learning more about when the clinical summary could be helpful for you. And we have thought of a few different use cases here. So maybe these match with what you were thinking, but again, please feel free to write to us your thoughts in Q&A about when the clinical summary would be helpful for you. But we thought of some daily team meetings and supervision, reviewing the client level details and after-hour calls, clinical questions in the field. Maybe at intake, you review the clinical summary to get a clinical history. Of course, for the CARES in Kansas assessment, and then any quality improvement activities or projects that your agency might be involved in. So if there's anything that matches what you were thinking or anything we didn't think of where the clinical summary would be most useful for you, please let us know. All right, we're almost done. Just 2 more sections, and then we can go into a quick poll and then Q&A. But I wanted to go over the PSYCKES mobile application because I know a lot of you are out in the field and it's hard to get back to a desktop, do all the things PSYCKES that you wanted to do. So I wanted to just show you what our mobile application looked like and what functionality we had in the PSYCKES mobile app. So it's really designed for mobile workers out in the field to rapidly pull up somebody's clinical summary to view their treatment history to help individuals in crisis or those even receiving just community-based care. So you can search for clients in our mobile app and enable access if you have, for example, consent. Or if it's considered an emergency access, you can enable access in our mobile app and then view the full client's clinical summary right on your device. So we also have an e-sign consent feature that's specific to the mobile app, and I'll show what that looks like. You can even use our Recents tab in the mobile app to view clients that you have searched for recently without having to re-enter search criteria for them. And then we have the option to complete safety plans or screenings and assessments like CSSRS or PHQ-9s from the field. And our mobile app is free. So this is what it looks like if you enter somebody's search criteria, like a Medicaid ID, for example. This is what the results page looks like. So very recently, we've made sure to maintain parity with our web application, and now we're showing somebody's planning considerations in the mobile app. So here out in the field, you can see, for example, if somebody's Medicaid recertification is expiring, and when that's expiring. You can see if somebody already has any documents added to their clinical summary. So that's a new feature of our mobile app. And then I'll just show how to e-sign the PSYCKES consent form. So on the results page, you can click or tap Enable Access, and here's all the same options that you have in the web, except this is mobile app specific for e-signing the PSYCKES consent form. So if you drill into e-sign the PSYCKES consent, this is where you'll review the overview of the process for e-signatures and then what to do after the client signs. So then you'll be prompted with the same question in the web. How do you know this is the correct person? And then this is where you and the client will review the PSYCKES consent form together just to make sure they have informed consent if they do choose to give consent, or they have informed denial of consent. So the next screen after reviewing the consent form would be where the client decides I give consent or I don't give consent. And then they can indicate if they do give consent, who's signing the form? Is it me, the client, or do I have a legal representative signing on my behalf? And then the next screen would be the e-signature section. So this is where they just use their finger and sign on the e-signature screen and then click next. This is just a confirmation screen to say that you'll work with your provider to discuss options for receiving your copy of the signed PSYCKES consent form, which is saved in the plans and documents section of the client's clinical summary once it's confirmed. And then on the next screen, you'll see that you're all set and you can have the option to drill right into the clinical summary. So that's the e-sign consent flow. I also just want to highlight our iPad and Android tablet view looks a little bit different because we have a brief overview option in the iPad and tablet view. So if you have that as your device, you'd get a little bit more information compared to the phone version of our mobile app. And we've already gone over the brief overview, so I won't spend too much time here, but this again is a quick snapshot of the client's most critical information that you can view in the field on an iPad or a tablet. And the iPad and tablet also has the past 1 year of the services over time graph. So just because of the space, we had more space with the iPad and tablet, so we were able to incorporate the graph in this version as well compared to the phone. And then more importantly, I wanted to talk about the safety plan template that we have. So this is available on both the iPad, tablet, and the phone. The option to complete a safety plan for a client. So if you tap complete a safety plan, this is where you can start filling out the required sections. You can also close even when you're not finished and save a draft and come back to it later. And then you can add it to the clinical summary and view the completed safety plan in the plans and documents section. And then screenings and assessments. So this is where you can complete the depression screening or suicide screening right within the mobile app with the client out in the field. And once you add to the clinical summary, you can see the results for that screening and assessment. And then very briefly, just to touch on MyCHOIS, it's the recipient-facing version of PSYCKES. So this is where, and I'm just going to jump to what our mobile app looks like. This is where clients can actually download the MyCHOIS app and have quick free access to crisis hotlines, crisis resources. If they get an account, which is created by you as the provider in MyCHOIS, once they create that account, they can actually access the recovery library, which has thousands of recovery-oriented resources. They can even view their own treatment data, which is another version of the clinical summary that you're viewing as the provider. So the client can be informed about their own services and medications and diagnoses that they've been receiving. And then plans and documents, the client can actually complete a safety plan on their own time within the app. And once they add it to their treatment summary, you as the provider, if you have consent, can view that safety plan in PSYCKES. All right, so I think, Cameron, we're going to go through this part a little bit quicker than normal, just for time. I want to make sure we have enough time for questions at the end. So this was our polling section where we really wanted to just get your feedback as PSYCKES users to learn more about what would be helpful for you to add or enhance in our application. So we're going to be using the Slido polling feature, and you should see once the first question is launched, you should see the Slido app option appear. If you're having trouble seeing that, just feel free to enter in your answers into Q&A. But we'll start right off with the first question. So we'd love to hear from you about what you would like to see for any enhancements that you wanted to be added, that you'd like to be added to recipient search. So are there any new filters that you could think of that I didn't show today that would be helpful for you as ACT teams in running group cohort searches for in PSYCKES? So new population filters? Are there any new demographic or social needs options that could be helpful? Especially when it comes to something like the CANS assessment. Are there any data pieces in the CANS assessment you typically have trouble accessing or learning more about that you'd love to be able to run a group cohort search on in PSYCKES? Any new service settings, like enhanced step down or any school-based service settings that would be helpful for you. Just going to toggle over to the poll. And some people haven't used PSYCKES before, so that is okay. Just keep this in mind when you do go into the application. You know, if there's anything you think of that you're not seeing there that you'd love to be added as a feature in PSYCKES, we'd love to hear from you, not just today, but I'll provide our help desk information and you can reach out to us at a later date. All right, I'm going to move on to, thank you so much for your responses so far. I'm going to move on to our second question, which is, are there any additional data sources that you'd like to see added to PSYCKES? I went over Medicaid billing and all of our state administrative database sources that we have so far. I know some of you aren't super familiar with PSYCKES yet, so of course, again, if this comes to you later on, please feel free to email us. But just if anyone is familiar with PSYCKES or just in general knows of, you know, data that they would find the most useful in the application, please feel free to let us know. It seems like so far we have a good options for our data sources, which is great to hear. We have quite a few, so but always interested in expanding our data sources and access. More real-time data. This is great feedback so far. Thank you all for your responses. And then I'm going to skip to question number 3. I'm sorry I'm going so fast. But again, these will be in the slides we send out. And if you think of anything in the future, I have on the next slide how you can provide those suggestions to us. So number 3 would be, would you like to see any functionality updates within PSYCKES? So some of those filters had multi-select options, the majority don't. Would you like to see more multi-select options? Would you like to see more look-back periods? Usually it's the past year. We have a couple other options for look-back periods already, but are there any specific look-back periods that would be helpful for you? Are there any new advanced view ideas that you have? And I know, again, a lot of you are new to PSYCKES, so if there's any type of population health report that you typically run that you think would be useful for a larger group of people, we could always consider making that into an advanced view for our users. All right, so we're going to move on to the next slide, and we can just keep the poll open in case folks think of anything else. So as you get familiar with PSYCKES, if you think of anything that you'd like to use the application for that's not already there, or if you're not even sure if it exists or not, we'd be happy to let you know. But you can always email us at psyches-help@omh.ny.gov and include the information below, which would be a description of the feature you'd like to be added, the purpose that the new feature would serve, and how it could really help a larger group of users. So you as ACT teams, we really want you to become super users of PSYCKES. So if you are running a report yourself as an ACT team staff member, and you're thinking, oh, it'd be really helpful to have this as a filter option in recipient search, I'm sure that could apply to a lot of other ACT team staff members. So please don't hesitate to reach out to us about your ideas and suggestions. We always love hearing from everybody. All right, and then I'm going to end on training and technical support, and then we'll go into questions. So we have a lot of resources available on our PSYCKES website, psyches.org. We have webinars like the one you're on today, but we have webinars that go through different areas of the application. So we have one dedicated to recipient search. We have one dedicated to our mobile app. We have an introduction to PSYCKES webinar, which is a more general overview of all of the screens in the application, which I would recommend if you're new to PSYCKES. So we have those webinars, we have our user guides, our release notes to see what the newest features are that were added. All of those can be found on our PSYCKES website along with the consent form, etc. So we also have our PSYCKES help desk, which we're available Monday through Friday from 9 to 5. So if you have any questions about getting access to the application or how to run a specific report, or if you're seeing information in PSYCKES that's not quite making sense to you, please don't hesitate to reach out to our help desk so we can look into it further. Sometimes people reach out to us and they help us identify a bug in the application. So if you ever have any questions, we always welcome them at our PSYCKES help desk. And then if you have issues, if you already have PSYCKES access and you're having issues logging in, like receiving an authentication error or issues getting your token set up, that's where the OMH help desk would come in at healthhelp@its.ny.gov. They'll be able to help with those login related issues. All right, I think we have plenty of time now to go through some questions. So I'm going to tap in Ashma now to read aloud any questions that came in that we can be helpful with on this call today.
Michelle, we do have a few questions coming in. So the first one is PSYCKES only for Medicaid line of business, or are commercial and Medicare members seen in PSYCKES?
That's a great question. So it's for Medicaid members specifically. We do have non-Medicaid individuals. So for example, if somebody does have commercial insurance, but they were recorded in the state psychiatric center EMR, they'd still be in our application with what's called the non-Medicaid clinical summary with that state PC EMR data. So any of their private insurance wouldn't be reflected in PSYCKES, but if they received that state PC service, that would be reflected in our application. We don't currently have Medicare data at this time. I hope that helps to answer their question. Sure.
Thank you, Michelle. And then the next question that we had received is regarding PSYCKES consent. So the question is, does each provider who accessed the information need to get consent? For example, if Dr. A in ED treated a client 2 weeks ago and client consent was obtained then, today Dr. B is in the emergency department and would like to review this same client's clinical summary, does Dr. B need to obtain a brand new consent from the client?
Oh, that's a great question. So if consent is obtained for a client at hospital A, then any PSYCKES user at hospital A will be able to drill into that clinical summary. You don't need to get a consent for each specific PSYCKES user at hospital A, if that makes sense. But let's say that client then went to hospital B would need to get their own separate consent for that client. if I hope that helps answer the question. Let us know if it doesn't, if you have further questions.
Thank you, Michelle. And then the next one that we have is regarding Medicaid recertification. So the question is there a way that we can search a particular agency's recertification?
A particular agency's recertification. I think I'm a little bit confused on the wording of that question. I think overall, if you run recipient search, cohort search, you can see on the results page in that planning considerations column who needs to recertify and when. Um, I think that's probably the best I can think of for an overall agency report for recertification. Um, but I think honestly, I would need a little bit more detail for a question like that. Maybe that's one we can take back and reach out to via email.
Thank you, Michelle. We did provide our Psyches help desk information, so we did let them know that they are more than welcome to reach out to our help desk and we can look further into it. But
Great.
those were all the questions that we had received, so I will pass it back to you.
All right. Well, thank you so much, everyone. I'm going to just flash up our Psyche's Help Desk email one more time. Again, this is recorded. The slides and recording will be sent to everyone along with our access table to see if your agency has Psyche's access and who your security managers are so you can get Psyche's access at your organization. So I really appreciate everyone's time today. If you have any further questions, please don't hesitate to reach out, and I hope you all have a great rest of your day. Thank you so much.